Hi everyone, it's Elise Kleckner. I am here to do my flashcard presentation on pelvic inflammatory disease. So, pelvic inflammatory disease, it's an infection that occurs in a woman's reproductive system, and it is commonly caused by STIs. The most common is gonorrhea and chlamydia. And it occurs when the bacteria spreads from the vagina up to the reproductive organs. And it can also happen in a few other ways, such as a woman having an abortion, miscarriage, or even having birth control implanted. Um, for the pathophysiology, when infection occurs in the reproductive organs and tract, it does cause scarring, inflammation that causes damage, and also adhesions and obstructions in the fallopian tube. And the result of this is that the ciliated epithelial, epithelial cells of the fallopian tubes, they get destroyed, and this results in a ovum not being able to travel to its destination, and it causes infertility. Um, some risk factors modifiable would be unprotected sex with multiple partners, women who douche often, because it's actually not good for the vagina or the cervix for you to douche frequently. And then also, part of this is modifiable, but the other part is not. So, women under 25 who are sexually active. Non-modifiable would be women of childbearing age and women who have IUDs um, within the first 3 weeks of having that. Signs and symptoms of PID would be yellow-green vaginal discharge with a foul odor, fever, and or chills. And then symptoms would be tenderness and pain in the stomach or abdomen, intercourse that is very painful. When urinating, you have a burning sensation and possibly an irregular menstrual cycle. Diagnostic tests is our last subject here. And it's usually a group of tests that actually helps to diagnose PID. So that could be from a blood test, a pelvic vaginal exam, physical health history, ultrasound, urine culture, and a round of tests for STIs. And that concludes my presentation. Right down here are my references that I used. I hope you guys enjoyed. Thank you so much for listening.